Hello and welcome to the channel. I am Dr. Pallavi Goswami, an ophthalmic surgeon practicing in Gurgaon over 20 years. Today we are talking about one of the most common eye conditions affecting millions worldwide, that is cataract. If you or your loved one is experiencing cloudy vision or trouble seeing clearly, this video is for you. So let's start. What are cataracts? Let's begin with the basics. A cataract is the clouding of the natural lens of the eye. The lens sits right behind your iris, which is the colored part of the eye, and helps to focus light into the retina, giving you a clear vision. Over time, the proteins in the lens begin to break down and clump together, forming a cloudy area. This is what we call a cataract. Think of it like trying to look through a foggy window. Everything appears like blurry, dim, or even yellowish. It does not happen overnight, and cataracts usually develop slowly and can affect one or both eyes. Usually it affects both the eyes, and the importance of the lens in vision. What is the importance is that the lens is one of the most crucial structures in the eye. Its main role is to focus light precisely into the retina at the back of the eye. When the lens becomes cloudy, light scatters instead of focusing properly. This leads to blurry vision, glare or halos around the lights, difficulty at seeing night, fading or yellowing of the colors, and in severe cases, cataract can lead to functional blindness if left untreated. The global prevalence and the demographics of cataract is that cataracts are the leading cause of blindness worldwide. According to the World Health Organization, they account for nearly 51% of global blindness, affecting around 20 million people. The condition is mostly age-related, typically affecting people over 60. But cataracts can also occur earlier due to diabetes, smoking, eye injuries, long-term steroid use, and even genetic factors. In India, cataracts are a major public health concern. Over 12 million people in India are blind, and more than 60% of the blindness is due to untreated cataract. So why is such a high number? Large aging population, lack of awareness in the rural areas, limited access to affordable eye care, and social stigma around surgery in older patients. And the good news, the cataract blindness is entirely reversible with a quick and safe surgical procedure. In the next few videos, we will explore the different types of cataracts, how to recognize the symptoms early, and when it's time to consider surgery. If you found this video helpful, please give it a like, share it with your friends and family, and don't forget to subscribe for more clear and simple explanations about eye health. Thank you for watching and take care of your eyes.